Recently, the FDA approved a promising new drug for weight loss called Wegovy. But is it really a game changer for weight loss? And how does it compare with other drugs that cause weight loss, like Saxenda? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. While we don't have too much experience with Wegovy yet, we can take a look at how it works and how it performed in trials to shed some light into what you might expect if you try it yourself. Wegovy is the drug semaglutide. Semaglutide is actually already being used off-label for weight loss by many clinicians under the brand name Ozempic, which is officially a drug for type 2 diabetes. Semaglutide actually started as a drug for diabetes and was found to have very potent weight loss effects. So, Novo Nordisk, the current owner of the drug, jacked up the dose and marketed it as the weight loss drug Wegovy. This is very similar to the marketing of the drug liraglutide. While it was being used for diabetes under the name Victoza, it was found to have good weight loss effects as well. So, they cranked up the dose and marketed it for weight loss. We now know this drug under the name Saxenda. How does it work? Semaglutide is a GLP-1 agonist. These drugs work by mimicking the effects of a hormone called glucagon-like peptide 1 or GLP-1. This hormone stimulates the release of insulin and also makes us feel full. So, Wegovy works primarily like an appetite suppressant. Like most other GLP-1 agonist drugs, it needs to be injected. However, Wegovy only needs to be injected once per week. Side effects. The most commonly reported side effects from trials are nausea, vomiting, and diarrhea, which is pretty typical of GLP-1 agonists like Ozempic. The higher dose given in Wegovy likely produces stronger side effects than in Ozempic. So if you've tried Ozempic and couldn't tolerate it, you probably won't enjoy Wegovy either. Studies on Wegovy showed that about 5% of people dropped out due to the side effects. Wegovy also carries the same warnings as other GLP-1 agonists, such as potential damage to the liver or pancreas, gallstones, kidney failure, and increase in thyroid cancers, and so on. So you'll need to check with your doctor if you decide to try it. Is it effective? As a diabetes medication, semaglutide is not very popular, mainly because it's so expensive, requires you to inject yourself, and is overshadowed by far more effective diabetes medication. However, as a weight loss medication, studies seem to show strong weight loss effects for Wegovy. Studies that compare semaglutide and liraglutide also seem to show that semaglutide is slightly more effective for weight loss than liraglutide. This would suggest that Wegovy may be more effective than Saxenda, although exactly how much is unknown. If you would like to see a more comprehensive comparison against other similar drugs in its class, we'll have a separate video on that. Is it a game changer? Although it's great to hear about a drug that seems to show a lot of promise, I'm not sure I'd call it a game changer. Wegovy's not really a new drug, and semaglutide was already being used as Ozempic off-label for weight loss. It seems Novo Nordisk just took Ozempic, more than doubled the dose, and called it Wegovy. The significantly increased dose makes it a better appetite suppressant, but is likely to come with increased side effects and decreased drug tolerability. But the larger problem for patients will likely be the cost. Wegovy is being priced at around $1,400 per month, similar to Saxenda. That's almost $17,000 a year. That's the cost to do lap band surgery. So it's not cheap by any means. And like Saxenda, many patients end up turning to cheaper alternatives, especially when their insurances refuse to cover these medications. So while it might be a game changer in research trials, whether it will be in real life remains to be seen. Nevertheless, a big upside of Wegovy is being able to have more options of FDA-approved weight loss drugs. It's good to see the FDA taking obesity more seriously, and this latest approval for an effective weight loss drug will continue to help clinicians and patients in the fight against obesity. What to expect? Much like Saxenda, Wegovy is probably best used if you have a hard time with controlling hunger and tend to overeat and snack too often. I always recommend developing good dietary and lifestyle habits whenever you take weight loss medication of any kind, as it tends to produce more permanent results if implemented properly. You might want to implement a stricter dietary plan, since Wegovy will make it easier for you to follow such plans. But avoid extreme diets. You should make sure your dietary plan has a good variety of macronutrients, like protein and fat, and micronutrients, like vitamins and minerals. For example, by following a calorie-controlled Mediterranean diet. All these nutrients are necessary for proper fat metabolism, and inadvertently depriving yourself of these nutrients by following too extreme a diet will make it harder for your body to burn fat and potentially cause long-term problems, like increasing your risk of weight rebound once you stop the drug. That being said, here are a few things to keep in mind before you try Wegovy. Firstly, the way it works as a weight loss drug is not much different from other GLP-1 agonists. This means that if you've tried any of the other GLP-1 agonists, particularly Saxenda or Ozempic before, and it didn't work for you at all, Wegovy may not work too well for you either. Secondly, stalled weight loss and rebound weight gain upon discontinuing the drug is common in most weight loss drugs if you don't control your diet. While Wegovy appears to have slightly stronger effects, it's not immune to these problems. I recommend doing your best to develop good dietary and lifestyle habits while on the drug to minimize these issues. And finally, Wegovy is quite expensive if paid entirely out of pocket, around $1,000 to $2,000 per month depending on your dose, and is not often covered by insurance. So depending on how long you decide to take the drug and your personal goals, you might want to consider other weight loss options such as a gastric balloon or a yearly comprehensive weight loss program. I wouldn't be surprised if most patients opted to try the much cheaper and identical drug Ozempic first, just to get an idea of how Wegovy might work for them. Let me know in the comments down below if you have any experiences with Wegovy yet. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.